Hi, everyone. My name is Solome Tibabu, and I'm your host for the Going Digital Behavioral Health Tech Summit. And I'm so excited to have Dr. Nina Vasan here with us, who is the founder and executive director of Brainstorm, the Stanford Lab for Mental Health Innovation, here to talk about their special, top secret framework for designing, developing, and evaluating novel mental health technologies. So Dr. Vasan, thanks so much for being here. You started the Stanford Lab for Mental Health Innovation in 2016. Why did you start it, and what did you set out to do with it?
Awesome questions. And Solome, I just want to start with thanking you, first of all. This is an awesome conference that you've gotten together. And, I did start working in this space, started the lab in 2016, started working in mental health tech in 2014. And I have not seen anything like this come together. Your leadership and vision over this has been awesome. So just thank you for being such a rock star. We are all grateful for you. On behalf of the whole community, we thank you.
Thank you.
So to answer your question, so let's rewind 4 years. What did the world look like 4 years ago? So, there's first the mental health side of it, and then there's the specific problem we were trying to solve. Now, when we think about mental health, we know, one of the biggest problems in the world, when we think about a supply and demand mismatch, I can't think of anything even bigger than that. And so we know that there are so many people who are struggling with mental health and not getting the care that they need. Then 4 years ago, what did we see? We saw that there were a lot of startups that were starting to get created and address these problems in the space. And 4 or 5 years ago, we had a lot of early stage companies, seed, maybe Series A companies, as well as even within larger companies and organizations, folks who are trying to think through, what do we do here? And what I saw, I'm here at Stanford in the middle of Silicon Valley. I was actually a psychiatry resident at that time, finishing up my training. And there were so many companies that I was hearing about popping up, wanting to solve some problem in mental health, whether that's prevention, diagnosis, treatment, management, cognitive behavioral therapy, like all these different ideas. And what I saw was that while there were so many companies out there, dollars being invested in really smart people who were trying to get out great ideas, there was a disproportionate sense when I looked at what was out there and the actual impact that was being made on my patients. And specifically, what we're seeing is that there just really wasn't that much of an impact. And it's like, why do we have all these companies if health is not getting better? And I can't tell my patient to use this because it's going to make them better. And then even from the public health perspective, we didn't have the outcome that we needed. Granted, the field was early. So what I saw at that time was that we need something to really change that. And in speaking with a number of entrepreneurs, investors, folks in the field, there were a few things that really stood out in terms of what was needed and what was not currently there at the time. The first was really a solid academic foundation from this unbiased perspective to be able to understand this field as a whole. Now, when we think from the perspective of medicine, everyone knows we have clinical research and bench research and how those fit into drug development and clinical trials, changing healthcare systems. But now what's been emerging over the last 10 years is this entire space around digital. But what we didn't have was actually an entity that could really look and study this whole digital landscape of what's going on, and then be able to make really thoughtful recommendations, as I said, from this unbiased perspective where, we're not attached to a specific company, we're not a specific investor, but we're really looking from that top-down perspective, what is needed. So the first thing is that I wanted to be able to create an actual academic discipline and have that integrity that I thought was going to be so necessary for the field itself to take off and flourish. The second was really being able to create a community. Everyone in the space was talking about how they felt so siloed, and to bring these different stakeholders together. And Dr. Gary Aragam on my team, who I'll talk about in a little bit, one of the things that she's been talking about from the very beginning is that we don't have a shared language. We have entrepreneurs, we have engineers, patients, clinicians, investors, and everyone's coming from their different discipline. And so then when we try to come together, it's really hard to talk to each other and even know that we're on the same page. So bringing people together was one big idea. A second big idea was having this actual academic thing where we could study the field and then really make recommendations for what does the field as a whole need. So that's what's happened when we started. And I think that, now, of course, when we look at COVID, where the mental health was a huge problem before, now it's, much, much bigger even than we could have imagined. And now there's this whole sense around, wait a second, the way we solve these problems needs to change because we need to leverage technologies in ways that we never have before. So that's what we sort of started off to do 4 years ago. And I think that what we were really looking at is how do we improve both access and quality? Now, the traditional mental health care system has been pretty good in one way. Startups have been pretty good. Startups have been pretty good in the access side. Traditional healthcare system, pretty good on the quality side. How do we actually get the best of those and work together to make the big changes that we need at scale? So what's been amazing actually is that over these last 4 years, what we saw in this field 4 years ago compared to now, it's completely taken off. Like there, when you look at the number of companies being created, the dollars being invested in, the number of users who have tried any of these technologies, it just grows and grows. And that's amazing. So now we actually have a new mission, because I think the original mission that we started off, we've actually met as the field has grown and developed. And now we have a new mission.
Ooh, tell us more. What is the new mission?
Do you like the little, you're hanging on the edge of your seat right now. So what our mission is to be an engine for powering better mental health by creating clinically informed, tech-enabled products that that really bridge the right gaps. And what I mean there is that we're really, at the end of the day, what we're trying to do is create products that really are clinically informed and valid, do the kind of the best of the clinical, the tech, and the design all coming together around reasonable business models, but then doing that for the right population and solving the right problem for the right vulnerable population. And so how do we do that? Well, there are a few things. The first thing is we focus on equipping companies first with the right resources. Now, what that means is, one, multidisciplinary, two, collaborative. So really thinking about that multidisciplinary collaborative knowledge, as well as skills and an ecosystem to have this whole community wherein then everyone in this community can build better clinically informed tech-enabled products. And in particular, we're looking at mental health for the vulnerable populations. I think as an academic lab, that's tremendously important to us, that while, there will be folks who are, when we think about mental health, one, in some ways everyone is vulnerable. If struggling with mental health alone makes you vulnerable. And within that, how do we then go a step further to make sure that the most vulnerable populations that are affected by, our societal structure and financial issues and things like that, that we're really tackling things for them. That's what's tremendously important to us. So this is all based on a few hypotheses. One is that if we focus on making things more clinically valid, right, then that means they're going to be more likely to work. First of all, that was the very first problem we talked about, right? If it's not that they weren't working. Second is that if we can focus on user engagement and making these tools and products more engageable, that they're more likely to be used. And then third, if it's more sustainable, that is, if there's a solid business model around the product, then it's more likely to last. So those are the big things we're thinking about: clinical, user engagement, sustainability around business model. And overall, what we want to be able to do is help people get more access to quality care, and doing that through products, right? Making sure that there are high quality products out there that are addressing the most important needs of the mental health population. And what we do is we're this interdisciplinary lab. And I'll get to this in a little bit, but basically we bring our skill set as people who are treating patients and know the public health side of things, know the product design side of things, and bring mental health to other companies. So we're not an incubator. We're not building things, in-house, but we're actually going to these other companies like consultants in a way, and working with them to design the right mental health tools and products for their population.
Awesome. Yeah, that's and also from what I know about Stanford Brainstorm is you have three main pillars: research, education, and product development. Tell us more about those three and what you do.
Yeah, perfect. So everything starts with a framework, and that's where you did a lovely teaser for our framework. So we have this 8-part framework on mental health innovation, and I'll talk about that in a bit. But the foundation of the framework is the foundation for really everything our lab has done. And it's really focused on wanting to have this solid academic insight and understanding to how do we actually design for mental health? That's what the framework is all about. And there are frameworks out there for other sides of this, right? Like how to evaluate apps or how to think from the clinical perspective. This is all about, if you are designing or investing in something, what in a product or a company, what does that product actually need to look like from multiple perspectives? So that's the foundation. Then we have research, education, and product development. And those are all based on the framework. So first, research. Our research, we've actually done an entire market-wide analysis of the field of mental health technology, where we have an enormous database of all the different companies out there. And we're cutting the data in different ways. Sometimes it's by looking at the epics or the way they address certain issues. Other times it's looking from clinical symptom. Others it's looking at business model, and really trying to understand from that top-down perspective, where are the white spaces, where are the big problems and opportunities, what is everyone doing well, and what then do we need to see for the field itself to get better. This market research is stuff that's really helpful, whether you're starting a company yourself, you're trying to decide what to invest in, you want to create something, you want to improve an existing product, really just trying to know who all's out there, what are they doing, and what's working. And then what we're trying to do is overlay this whole clinical side of it, where it's like, okay, we know, for example, there are a ton of mindfulness apps. That's great. I love mindfulness, prescribe it to all my patients. And in terms of what else we need a whole swarm of other things that are not in that space. And so if we look clinically at the pathologies out there, what are people struggling with? Depression, anxiety, substance use? How do we actually make sure that the new things that get created are addressing the right problems and the right population? So that's what we're trying to do there, is just make sure there's that alignment in the way that, maybe if there were a federal organization to oversee this field, they would be putting out recommendations like that. In the absence of an organization like that right now, that's what we're trying to do. The second is education. So we actually teach 2 courses at Stanford that are very interdisciplinary. We have folks from all the different Stanford graduate schools. It's a graduate school course where over the course of the course, students learn about the framework and they use it to then actually pitch a company idea that they have worked in teams to put out there. And you were one of our judges. So thank you for that. And, really being able to share your own wisdom and insights with these students. We have these, brilliant Stanford students. We actually have we have VCs who took the class. We have entrepreneurs who took the class who are not in school right now. But that's kind of what we're trying to do, is actually, how do we build that pipeline, both of talent and of good quality products? And that's what we're doing on the education side of things, as well as having events. We actually have some events that we're planned for right now with Eleanor McCants-Katz, the Assistant Secretary of Mental Health, and Kevin Love, a basketball player who's been very active in talking about mental health. Then COVID happened, so those events are now going to be in probably fall or winter or spring of next year. But what we're really trying to do is bring people together from different disciplines, all around this lens of mental health innovation. What's out there? How do we make it better? Third, we have actually creating product. And this is my personal favorite, I have to admit. You're not supposed to have a favorite, but I totally have a favorite, and that is the product design. And what we do is, when we started off Solome 4 years ago, we were working with, small startups, seed stage, Series A type of startups. And what's happened over the last few years is that now all these people, all companies, huge companies, are now interested in mental health, both from the perspective of how do they help their employees as well as their customers. And they're looking, how do we incorporate mental health into the products we're already putting out there? And so we're partnering with Fortune 100 companies to build out products, working with them, as well as, tech giants, organizations like nonprofit organizations and other entities that are committed to mental health. And we're trying to focus on anyone that has at least 100 million users or kind of people they reach in some way. That's kind of how we're trying to think of, how do we then, knowing what we know, the skill set we have, how do we take it to these companies and organizations who already have a large reach, right? Where if we work with them, we can get things out really quickly to a big population.
Amazing. Yes, and I can vouch for how awesome all of those components are. And you can't do that kind of a thing without an absolutely all-star team. So tell our audience about, who's running all of this.
You're absolutely right. And I have to say that, like, working with phenomenal people is ultimately, the thing that really drives me just as much as we care deeply about mental health and are very, very purpose-driven and mission-driven. And getting to have a phenomenal team is what just makes all of this such a joy. And I feel very, very lucky to have some awesome people who I work with and who really helped build all of Brainstorm and get it out there. First, we have a leadership team of 3 young women. So there's myself, Dr. Neha Chowdhury, who's a Harvard psychiatrist, a child psychiatrist, and she focuses specifically on kids and parenting. She's done enormous work with schools and school systems in multiple states, really trying to think of how do we, when we think about kids, kids are really the best place to intervene in terms of prevention and starting early when it comes to diagnosis and treatment. And so she's done phenomenal work with kids and parents, thinking about like practical tips. How do we translate the scientific evidence to make these really actionable things that parents and kids can do? How do we work with school systems and integrate into existing platforms to really deliver and make sure that that's a key player in the space? And then she's also a journalist. She actually just published in the New York Times last week on parenting and what kids need. And so I think that she's been able to bring a phenomenal experience in kids, youth, parenting, and also really thinking through systems. So that's one person. Next, we have Dr. Gari Aragam, who I mentioned a few minutes ago as being the person who really had that sense of we need a shared language for this space. So Dr. Aragam is a Harvard adult psychiatrist, and her focus has been, she actually was one of the first people I knew to enter digital health, probably about 10 years ago. And she's been really focused on the medical clinical side, like when we think about the intersection between mental health and other diseases like heart disease, diabetes, where is that best intersection, both clinically as well as from the health systems perspective. And then she's done tremendous work really specializing in minority populations and has whole streams of research around the African-American population, Asian American population, of what do they need when it comes to technology and what are the tech solutions out there? How do we best engage and deliver the right product to the right person? So that's both of their backgrounds. They're the only people I know who are like Harvard and Stanford at the same time affiliates, because they're just these amazing badass women. And then a little bit my own background. My background sort of started with social innovation. I wrote a book called Do Good Well, which is a how-to guide on social innovation. And that actually is the foundation for our framework, which I'll talk about in a minute. And my background has been a little bit in business and policy. I worked on the Obama campaign in 2008, worked with the Director General of the World Health Organization. So I've kind of been looking on the business policy and the kind of like systems wide. How do we think about changing systems as a whole? And what I love about the team is that the three of us really come together. We're all we're all psychiatrists who have different clinical focuses ourselves. But then how do we bring that together to be able to not only be informed clinically, but then create really great products. And then round that out, we have a phenomenal team of about 15 interns and fellows and folks who are come from all different perspectives, from law and engineering, business, healthcare, obviously, and really working together as a research lab that is focused on translation and really trying to think through from the interdisciplinary perspective, how do we bring different frames of thought together and ways of problem solving together. And then, of course, we have, we really try to work really actively across the Stanford campus with other faculties, as well as with other organizations and companies. That's what I've loved being an academic lab. I think that it gives us the opportunity to partner with so many awesome people and really get out in the community in a unique way.
For our audience, I'm sure you can empathize how challenging it is for me to introduce the Stanford Brainstorm team to others over email, just like, where do I start? But without further ado, I've got to ask, you've created an 8-part framework for designing for mental health. Would love to hear more about how that came to be and what it's all about.
Fabulous question. Let's see, if I share screen, that's what I want to do. Great. So I guess this is actually I've been saying this for a few years, just kind of set the stage, that mental illness is the greatest thief of human potential today. And that's actually usually how I start off talking about this field, especially for those who are not in the field, to really help then set the stage for what that means, is that this really call to action, that we have the greatest opportunity now to lead change. And that's really, that's the kind of challenge ahead for all of us at this conference today. So overview of the lab. So here we go. Here is our framework. So this is the Stanford Brainstorm framework for mental health innovation. And it's really all about how do you design for mental health? And we're actually working on the visual of this. This is our first draft, so please do bear with me. And when you see it, you'll see it published. We're actually working with Tom Insel, who's one of your phenomenal speakers, to get this published in the next couple of months. So you'll see it soon, but you're seeing it here first at Ptolemy's conference. So what we have here is an 8-part framework, and this is having looked at a number of companies out there in terms of on the digital mental health side. What were they doing? What worked? What didn't work? When it comes to clinical, business model, having those outcomes, all of that. And then we really tried to differentiate, those success stories to figure out what ultimately are the core components that you need to be able to build a successful product. And so that's what you see here today. I'll do just that very high level of this and get at kind of those 8 different components. So the first 2 that we felt like these are sort of the foundation of what anything has to have are safety, and that it's safe and effective. Is it safe? Does it work? Next, we have on the kind of healthcare data side that it's measurable and collaborative. Measurable meaning both that there are multiple things we can measure as we think about things like digital phenotyping. You've thought about all the different forms of passive and data collection, as well as then actually like measuring outcomes as the company continues and everything. Collaborative is around collaborating with multiple other entities, whether that's whether that's like the healthcare system or other types of apps on your phone. Like, how is this integrating with other facets of the user experience and healthcare? Then we have the tech and design elements. First, empathic design. Ultimately, designing for someone who is struggling with their mental health is very, very different from someone who is not struggling with mental health. And so we have a whole area around really thinking about who that mental health user is and from an empathic perspective. And then accessible, who's able to reach it, who are the different populations you're reaching out to. Then finally, we have the business side of things, which are 1, sustainable, that's going to last, and 2, scalable, that it's going to then be able to scale to multiple types of people, populations, and everything. You see that we have it charted on this axis when we're looking everything from individual to system, as well as product to clinical to product. But really what we do here, I think the most important thing to take away is that these are the 8 criteria that we have determined from the interdisciplinary perspective are the most important. And what we do then is this is what the whole class is based on. And when students or anyone is coming up with a company pitch, they have to address each of these areas, because what we've seen is that if any of these areas are not addressed well, then that leads to some failure of the company, either clinically, business, UI, UX, technology, et cetera. So then when we work with companies, we work with investors, we work with who have their portfolio companies, we work with startups, we work with large companies and organizations, tech companies. We bring this to them, and this is the foundation when we are building products. It's almost like our checklist, if you will. Are all these areas addressed? And then we can do a deep dive. We can say, well, it looks like some of these are really good, but the measurement side is what's really lacking. Then we go in depth and we have a whole set of criteria around measurement to be able to make sure that the right things are being addressed in the right way. So this really helps us both figure out, what are the questions you might be asking the audience, right? Maybe you're trying to figure out, how do I actually build a good product, or how do I improve the product that I've built? This obviously helps with that. Maybe you're someone who's actually deciding, what do I invest in? Do I want to, maybe I'm a venture capitalist, maybe I run a company and I want to figure out who I can acquire or who I can license. This is going to help you ultimately evaluate all the companies out there to say, is the company I'm looking at actually going to be successful? Is it meeting these criteria? And so we can work with you to figure out if they're doing that. And then if they're not, actually then, doing the process of working with them so that they improve and have touched upon those elements. As the framework as a whole, what I'd love to do is, these are just, folks we work with, investors, entrepreneurs. Right now, our primary focus has been, I suppose, a mix of Fortune 100 companies, as well as working with investors who have multiple companies in their portfolio that are addressing mental health. But then everything from, organizations, media, policy, all of the above, all are tremendously important in order to move the space forward. So what I'd love to do in the final few minutes is actually just do a case example of one of the companies that we worked with, and to talk through with you what their problem was and how we worked with them to actually solve the problem. And what I want to start with is our kind of motto: meet people where they are. And in psychiatry and in mental health, we say that both kind of figuratively and literally when we're talking about patients and how we deal with patients. In this case, we apply it in another way of, if we think really, where are people today, right, in 2020? And where are people living their lives That's really online. And that's what actually got us interested in working with companies, working with tech companies and social media companies, is that, when the majority of people who struggle with their mental health, they're never going to come to me as a psychiatrist in my office, right? But what's happening is they're living their lives online. What if we could take psychiatry to them, right? Meet people where they are, where there are is online, and deliver the same types of tools and insights that I would do when I'm with my patient one-on-one in clinic, but instead get it out there to the masses in a way that they then don't have to go searching for it and go through that kind of painful process of, that they have to do, but that there are multiple resources out there available to them once they realize that they want to get some help and what might be going on. That's our overarching theme. So Pinterest. So Pinterest is the first product that we put out actually about this time last year. And so I want to just kind of briefly talk you through what was going on in Pinterest at that time. So there were three big things that they saw. The first, now when people go to Pinterest, most of my friends I know, when they've used Pinterest, it's been because they're wedding planning or they are moving into a new apartment. So they want to look at different like interior design, couches and everything, or fabric samples. And so that's how, most people use Pinterest. What Pinterest saw though, was that when they looked at the data of what people were searching for, one of the most common categories of search terms was all around mental health. It's actually, I think, the fourth most common category. So people were going to Pinterest searching for terms like depression or sadness, or how do I cope with anxiety, or stress quotes. So that was one really big thing for them, of realizing, wait a second, people are coming to our platform looking for mental health help. What can we do about that? Now, this is then what they would see when they type something like that up. So they would write at Pinterest, a year ago, they would get all these pictures, things like top 10 lists, or different images or quotes that people had come up with. And the problem here was that then if you searched for it, the search results there's just sort of information overload. You get so many things, it's hard to even figure out what you should be using and why. Then there was a second area. So that's sort of the stress and anxiety arm of things. Lots of people were searching for this stuff, not getting great help there. The second area was kind of the other end of the spectrum when we think about mental health, around suicide and self-harm. And what happened there was that there was actually a case in the news about a year and a half ago of a teenager in the UK who had died from suicide after going on Instagram and Pinterest and seeing a lot of kind of dark images. And what happened was, not only did she see these images, then there were push notifications and similar images were being pushed to her inbox. So this was big in the news about a year and a half ago for multiple, there were multiple companies, multiple social media sites that she had engaged in. And so what Pinterest realized was a few things. One is that they really want to think about what is that user experience if someone is struggling with suicide or self-harm, and how do we do this in a clinically informed, stigma-free way. And so a year ago, what would happen if you search for these on Pinterest? This is what you would get. You would get these very kind of dark posts. And then after this case happened around the teenager, they actually kind of almost flipped and did the opposite, was they made these terms that would not come up with anything. Right? So then if you typed in something like suicide, nothing would come up. And you can see you get, oh, maybe you meant Valentine's Day cupcakes or football cupcakes. I think this is because I might have searched for cupcakes, so cupcakes end up in my feed pretty often. But on a very, very serious note, what happens here is that when presented with something like this, it's very invalidating and it worsens stigma. So these were the multiple problems that we were kind of faced with when we started working with Pinterest, and had really, had a experience that what they wanted to be able to do was keep users safe and provide them with evidence-based content. And so what we did was, first of all, I just have to actually give a little disclaimer of, from financial disclosures, I do consult with Pinterest. And so that part is there. And I will say, knowing that I've now given that disclosure, they were a phenomenal company and team to work with, really just incredibly focused on what is the best scientific evidence, what do we do how do we keep our users safe, and what is the best we can do for our users. And as a clinician, it was really, really powerful to get to see just their values, I think, at the end of the day, and how aligned our values were around what we want to build. Great experience. So first starting with this kind of traditional, this like suicide hotline sort of work, which is in most entities. But then really what we were focusing on is how do we actually provide resources? So as I said, with the team of clinicians where we're all seeing patients, how do we take what we would do with our patients and actually give it to the Pinterest user? So what we did was we worked with them to actually create products. So now what happens when you type in something like depression, as you can see here, is first you get this new pop-up box that says, if you're feeling sad or stressed, here are some resources that may help improve your mood. And just to give you a background of how we were thinking about things, as we were working with them to create this, we looked at everything. We looked at the clinical side, how do we optimize efficacy and safety, the brand side of things, how do we optimize scale and fit, like what is the Pinterest brand and how do we keep things in the Pinteresty way, design around really engaging, optimizing engagement and scale, and then finally the legal privacy end. So for example, none of this data gets tracked. When we were starting this is when there was a lot of backlash around Facebook and all the data that gets collected. So this stuff is all done on a separate server. There's no tracking of who is looking at anything. So it's very, very safe and the users can feel safe in using it. What we ultimately created was a product that is called Compassionate Search, really thinking about how do we change the experience of how people are searching for and engaging in mental health online and make it something that's compassionate, where when they are asking for help, we meet them where they are and we give them that help. So this is what happens now. So it's both in the app and online for Pinterest, that we basically created all these tools based on cognitive behavioral therapy, dialectical behavioral therapy, mindfulness, gratitude, basically all the kind of top evidence-based therapies that we have. And we turned it into these short, 1 minute, 2 minute, 3 minute little exercises that people can do in the platform itself. So this is just, I'm going to run through because in the interest of time, this is just some of the, accept emotions, kind of talking through that. So these are the different things we created. And what I'll point out is that, it wasn't just like the text of the therapy. We also looked at a lot about the design. So for example, we know that nature images are calming and relaxing. We know that the color blue ends up, there's a lot of research around colors and how to design with the best colors. So we thought about this from very multiple perspectives around what do people need for a good quality product to improve their mental health. These are just some others. What I'm really most, I should say, proud of is actually the whole set around suicide and self-harm, because while there are other tools out there I think that address anxiety and depression, this was the first social media company where we worked with them to actually do a whole toolkit around suicide and self-harm, and specifically at that level, right? Pinterest has 300 plus million users, and so I think that instead of just getting this hotline, which is really important, but you need so much more than a hotline, I think, to be able to actually provide these resources was really fulfilling. And so now it's been deployed in several other countries and multiple languages and everything. But the final thing that I'll mention before, the first thing we did was actually create this product, right? Content-driven product. The whole second set of things that we did with Pinterest was what we call micro interventions. And that's in actually changing the platform itself and the user experience to address kind of our clinical goals. And so just to give you an example, so for example, when you type in something on Google, it's going to autofill into, what it thinks you're going to say. Now, if we have all these kind of trigger words where if they are these dark trigger words like around suicide, self-harm, it does not autofill. You no longer get push notifications if there is dangerous content. We also worked around the AI with them around the AI itself and identifying what is the right self-harm suicide content. And the algorithms actually have then reduced the suicide content by, I think it was 88% as of just a few months later. This was October of 2019. So, what we're ultimately trying to do is think about, at the end of the day, so many people struggling with mental health. How do we meet them where they are? Take mental health and what we know as clinicians, having treated mental health, take it to companies and organizations that are trying to solve problems in the space and work with them from the perspective of strategy, from the perspective of product development, UI, UX, and really change the offerings and tools available to people no matter where they are, and really trying to address the most vulnerable folks among us. So final note is that, in terms of who's in the audience today, I think that there are a number of folks who were really best able to partner with. One, investors, as I said, if you're trying to figure out what to invest in, or you have portfolio companies yourself, being able to kind of help you think through the investment side of things, as well as working with the companies, entrepreneurs, and anyone building, basically. We are here. We love to be able to partner. I think, collaboration is ultimately one of the most important values that we have, and what we need as a field to work together to be able to solve these really huge problems and do it well. So I will end there. Please, send us an email, brainstormlab@stanford.edu, and continue this phenomenal conference that Solovey has put together. And it was a pleasure getting to talk to you. Please do reach out. Would really love to work with you and start solving these problems.
Amazing. Thank you so much, Dr. Vasan. And everyone, stay tuned. Follow up to learn more. And thanks for following along.